to Dr. David Zahalik of Main Street Medical Care, and today I want to go over with you some information about allergies. And of course, here in the Dallas area, anybody who drives a car sees that it's covered with a kind of a yellowish coat, and that's the grass and tree pollens that are big right now. And we're having high pollen counts. So people here are definitely no strangers to allergies. So let's talk a little bit about what they mean in this video, how they work, and then in the next video we'll talk about treatment. And hopefully you'll get some useful keys for treatment of your own allergies if you have them, or some member of your family. So it's probably worth pointing out to begin with that there's both outdoor and indoor allergens. Outdoor allergens tend to be seasonal and indoor tend to be year-long. So the indoor allergens are things like dust mites, allergies that you might have to pets, to cockroach is very common, and to mold. So those are the big ones in terms of indoor allergens. Then outdoors are seasonal. Right now, springtime is going to be grass and tree pollen. In the fall, we'll get into a ragweed allergy, and then in the wintertime it's the cedar trees, red cedar and mountain cedar. So that's what we tend to have around here. Now, what actually happens when you have allergies or an allergy attack? It's an interesting story. I don't want to belabor it, but our immune system is basically built to protect us from invaders. And allergies are just our immune system in action. So there are cells, plasma cells and mast cells, that cause the release of chemicals to protect us from what is perceived to be a foreign invader. In this case, it's a pollen. For example, right now it would be a grass pollen. So the plasma cells make antibodies. Those antibodies stick to the mast cells, and the mast cell is just a big bag of histamine granules. And so when that grass pollen comes in and it hits the mast cell in your nose, it causes all that histamine to be released. So what histamine does is it causes blood vessels to dilate. So all the fluid and inflammatory mediators that are inside your bloodstream now leak out into the tissue. So the tissue swells, and your nose starts to itch and run, and your eyes start to water and itch. And it's all initially because of the histamine. Now, later on, there's a second pathway called the leukotriene pathway, and that kicks in about 4 to 24 hours after the exposure to the antigen. And that's the reason why sometimes you'll have an exposure that's limited to in the morning time, but you may have symptoms that last all day long. And so I mention that because that may be important to the treatment that's right for you, whether we're treating kind of the acute phase or the late phase reaction. And sometimes the tissue gets so swollen that there's nothing you can do except for to decrease the swelling to allow, for example, in the nose and sinuses, to allow air to get in and out of those sinuses. So, what are the complications that come from allergies? Probably the most common one that I see is recurrent sinus infection. And in fact, they say that 70% of people who have recurrent sinus infections have it due to allergies that are untreated. So 65 to 70% of people just don't have their allergies under control. And that can be a problem because of recurrent use of antibiotics, creating antibiotic resistance, and, not to mention just the time off work and the aggravation of dealing with sinuses. Ear infections are another common complication of untreated sinuses, especially in kids who have smaller passages, and when the fluid, fluid builds up due to allergies in the middle ear cavity, it's a great breeding ground for bacteria that'll live off of that inflammatory fluid. Asthma is also very common in conjunction with allergies, and allergies may be driving the asthma, so it's useful to get them under control. And then anaphylaxis refers to an allergic reaction right in here in the narrowest part of your airway, just above your voice box. If that area swells, because the width of that is about the width of your little finger, if that area swells, it can close off your airway, and you can die basically from, having a closed airway. And so anaphylaxis is not really common from grass and tree pollen, but it's more common with things like medication allergies and insect stings. But, it's worth noting that not allergies are just a mundane problem. Sometimes it can be something that will put you in the ER, or something in the case of anaphylaxis or asthma that can actually be fatal. So now what can we do to figure out if allergies are a problem for you, and specifically what you might be allergic to? Well, in general, you could think about testing in two ways. There's a blood test called RAST, R-A-S-T, which just it's simple to do. Any doctor can do it, and it'll just show if you have antibodies to certain type of allergens. So it can show if you have antibodies to cat dander or cat urine. It can show if you have antibodies to grass and tree pollen, some of the common ones that are around here. So it's a simple test we can do to detect the presence or absence of allergies. And then more commonly, you see skin testing, which is scratch or prick testing. And the difference between the two, there's several, but one of them is worth knowing that the results of a skin test can be used to make up an allergy serum, and then you could get allergy shots from that. Whereas the RAS testing doesn't allow that ability. But with the skin testing, a small amount of the allergen, let's say grass pollen, is put under your skin, and the amount of allergic reaction, the amount of redness and what they call wheal and flare reaction is used to indicate your level of allergy to that specific antigen. And sometimes you can have symptoms that you'd swear were due to allergies, but your allergy testing comes out normal, that you don't have allergies. Well, there's several things that can cause, for example, a runny, drippy nose with no allergies, and those are things like vasomotor rhinitis. That means that some people, when they're around cold air or ozone, their blood vessels dilate, much like we were talking about with the histamine response. And there's treatment for that, but it's different from some of the common treatments for allergic disease. Hormonal situations like pregnancy and thyroid disease can cause the same thing. Again, there's treatment specific to vasomotor rhinitis. You could have the common cold. That's a very common cause of a runny, watery nose. And then there's another condition called rhinitis medicamentosa, which is nothing more than the overuse or abuse of over-the-counter nasal sprays that are decongestant based. These are things like Afrin, Dristan, Otrivin. But if you use them long enough and every day, you get to a situation where you're dependent on them, and if you don't use them, you get the symptoms, quite severely actually. So, and there's a treatment regimen too where we can get you off of those and onto something else, and that's very effective as well. Now, the final topic that I want to cover about allergies in this first part video is how to avoid. And there's a lot written on this. I'm not even going to go into the information on how to avoid indoor allergens, but there's quite a bit written, and contact our office if you want that information. But in terms of tree pollens, one of the best things to do is to stay indoors more and just not go outside. I mean, you can only take that so far, but it can be a very useful strategy, especially when you're at home, to keep the windows closed, and when you're in the car to do the same thing, keep the sunroof closed. It can be very inviting on a beautiful day to have windows open and the roof down, but it can definitely stimulate your allergies. It's also good not to dry your clothes outdoors for the same reason, because all that pollen is going to stick to the clothes. And then it can be very helpful if after you spend quite a bit of time outside, that you take off the clothes that you're wearing, put them in the wash, and take a shower so you can wash all of that pollen out of your hair and off your skin. And also, in terms of cutting the grass at home, best just not to do it, or if you have to cut the grass, wear a mask so you can decrease some of the amount of pollen that's going right into your nose and mouth. So those are some ideas about what allergies are caused by, how they impact the body, and what you can do to avoid. And on the next video, we'll go into some of the treatment protocols. Thank you.